So capacity building of health workers is very important. There's this attitude of I know it all. It should not be allowed to flow. Should not stop with training and retraining, but also ought to include development of detailed step-to-step protocols, which I've already talked about. A strong surveillance team is very important. Monitoring global health on a second-by-second basis is needed to intercept any ongoing epidemics. I know that each time you turn on CNN, you will see people in the personal protective equipment from the month of February, March, and yet we did not alarm ourselves and say, what if this gets into Nigeria? We should have been in a state of preparedness. Therefore, there should be instituted anticipatory precautionary measures, which will be transmitted through an already established information relay system to all the infectious disease control units in the country, who will, in turn, immediately sensitize the entire hospital community down to the reception desk, to the reception clerk, because soya was received by a reception clerk. That is likely to receive the patient. That is the only way we can be prepared to combat such biological weapons of warfare, such as soya or Liberia decided to use for a suicide bombing. Now, running through now, we need to have more supervision and make sure that we don't allow quackery with impunity. The newspaper cutting slide, please. More regulation and oversight of healthcare services, providers and facilities, and seriousness with development of forensic medicine. The newspapers have fake Cameroon doctor invades Taraba, and fake doctor slaughters patients, and 50% of laboratories in Nigeria are manned by quacks, and 2 days after death, a woman rises in the morgue. There's a disregard for environment. We are not mindful, even in the hospitals. Disposal. Now, the School of Hard Knocks is a great teacher, even if the tuition is high, precisely because the lessons make such deep imprints. The first Ebola outbreak in Africa was 38 years ago, and Africa was yet to find a cure and an intervention 38 years later. The disease is for Africa, and the solution for the disease remains with Africans. And Nigeria, as the giant of Africa, should take the lead in the area of revamping the pharmaceutical industry and creating the infrastructure necessary for vibrant clinical trial industry to flourish. And this industry has been said to be capable of empowering our nation even more than crude oil is currently doing. And I wonder why we are still sitting on our ears. Now, the non-communicable diseases, please. Can you go to the non-communicable disease? You are what you eat. The preventive silent killer with shared risk factors that is threatening development and consists of both undernutrition and overnutrition. And in Nigeria now, a lot of us are suffering from overnutrition, such that we carry them in our, midriff. And most of the time when you are about to greet somebody, especially men, you greet their stomach first before the individual arrives. So you have that 7 of the top 10 leading causes of death are linked to diet and nutrition. Now go three slides up and show where all the flaps. He said, if you care about the quality of your life and your loved ones, reducing your abdominal fat should be one of your top priorities. Can you go to the cancer slide? Next one, yes. Next to that. Yes. Can you believe that these grotesque breast cancer lesions are still in abundance? Recently, a US group came and did a mission in Anambra State, and they harnessed loads of lesions that are similar. And this is a legacy of ignorance, procrastination, superstitious beliefs, it's not my portion syndrome, and all leading leading to late presentation syndrome. The WHO said if you were asked to choose 3 reasons why the increasing incidence of cancer in developing nations, it will be late detection, late detection, late detection. And so if it is late detection, that means that we need to up our awareness. There is a need for that, and therefore Lagos State's strategy, and it cuts across for malaria, for TB, for measles, for whatever infectious disease and non-communicable diseases. The same remedy, the same preventive measure would be amenable. Lagos State strategy of malaria control, a workable template to apply across the country. Operation Clean Up Lagos campaign. The food soldier approach by BWS to solve the late detection syndrome. Creating an army of advocates, no matter even if they don't have any medical qualification, just teaching them the basics and making them have a one-on-one with the population. Because when they hear it on the radio, it's not my portion syndrome. When they see it on the television, it's not my portion syndrome. But when they are in front of you, eyeball to eyeball, they begin to identify themselves in the circumstance and begin to believe and accept it. So we need all hands on deck. There is no need to reinvent the wheel. The next slide, please. There's no need to reinvent the wheel. Successful templates abound, and we have it in the paper that I have, that you have with you. There are many of them. So the kangaroo mother care, there is a successful model in Rivers State in collaboration with the Shell Petroleum and the Rivers State government and the people of Obio communities. They are operating a viable, health structure, which shows that we can do it with the right governance structures in place. And it's an attestation that to really achieve sustainable development, people have to be active participants in social services targeted at them. I'm now concluding. I want the governors here to take this as take home. The government, first of all, every time the IBM's founder said, every time we've moved ahead in IBM, it was because someone was willing to take a chance, put his head on the block and try something new. I'm sure that answering progressives, you're ready to try something new. It's going to be revolutionary, but I'm sure it's doable. The government should ensure that health is regarded as the right of all citizens of the country, irrespective of status. They should replicate the learning from the proof of concept pilots that are listed in the booklet. They should give the nation a revolutionary but result-oriented healthcare sector reform. They should focus on reduction of urban-rural differentials and disparities in health status. The fact that you dwell in the rural area does not remove your right to adequate health care. Until we put health back on the political agenda, nothing will change, nothing absolutely will change. They should encourage legacy projects and involvement of individuals and society and families in healthcare. They should emphasize corporate social responsibility for companies benefiting in Nigeria, and note that to really achieve sustainable development, people have to be active participants in social services targeted at them. Now, after climbing a great hill, one only finds that there are many more hills to climb. This was said by Mandela. In a lighter mood, this person was told by his doctor to avoid any stress, so he decided not to open the bill of his doctor. For several years, we have all watched helplessly as the Nigerian healthcare delivery has taken its toll on our beloved citizens. The time to reappraise and act is now. Futuristic testimony, run to the ending slides. You have PHCN, and this is a testimony that PHCN is given. For 50 years, I suffered from epilepsy, but today, praise the Lord, I think I can see light at the end of the tunnel. We are anticipating that with the progressives, we should be able to have such testimonies. Several Nigerian survivors tell stories of how they travel to developed countries for treatment, but not many people have the luxury of this choice. The Nigerian health system is all they have. We have the health professionals with the skill and willingness to deliver better health care, but they are constrained by the lack of infrastructure and management and enabling environment. Competition among emerging nations is strife. Nations are focused on out-thinking and out-strategizing each other in the scramble for the global market. So, there is a healthcare fair that is about to take place in Abuja next month, and is targeted to let our people know what we have available as a healthcare structure. Because people go to India to do appendectomies, which is not necessary. There are definitely many barriers to access and quality of healthcare services in Nigeria. Can the progressive governors make a change and turn it around? Someone has to take the responsibility of reaching the people and arming them with the right information. In 20 years, we will all be more disappointed by what we didn't do than by what we did. Closing slide now. According to my research, laughter is the best medicine. Giggling is good for mild infections. Chuckling works for minor cuts and bruises. Snickering only makes things worse. And bathing in salt and water will kill Ebola virus. Thank you very much for listening.